Welcome to the Redox 5. We've got a great show for you tonight. And while we're getting set up, tell us who you are and where you're calling in from so that we can welcome you to the call. Let's see, we've got Illinois,
Oklahoma, Kansas, the Philippines, Melbourne.
We got far.
North
Hey, Paul.
Carolina. Yeah, fantastic.
Denver. Here they come like crazy now.
Yeah.
Oh my God, they're going too fast. Oh, Illinois, Calgary. Hey, Cindy.
Spokane.
We got a good group coming on tonight. Hey, thanks, you guys. This is fantastic. Right before the convention, too. So, Little River, South Carolina. There's Laura Zentmeyer. Hey, girl.
Hey, Laura. Be like Hunter. Yes.
Like Hunter. Everybody likes Hunter. And how about Hunter's new look? I'm digging it.
Yeah.
Yeah, I'm digging it. So, in any case.
That's the Alaskan country boy look, right, Hunter?
Yeah, that's what it is. Just true to my roots.
I think he needs
There you go.
He needs a guitar. So in any case, we are the Redox 5. I'm Dr. Maureen Hayes coming into you from Galveston, Texas, and we're joined by Jim and Ann Glenn from San Antonio, Texas, and is our nutritionist and personal trainer. Jim is our big money man. And of course, we have the incredible Dr. Lee Osler from Washington State, dentist extraordinaire and author of several books on redox. And tonight we have a fan favorite. They're already saying they love him in the chat. Hunter, I said a different last name, Hunter Dean, who is our senior vice. Y'all, I'm sorry. I'm fasting. I'm a little out of my element. Hunter Dean, who is our senior vice president of research and development and our production operations. Absolutely amazing. And you guys, if you are coming to convention, we are 1 week away from Hunter Unplugged. This is something we've all been waiting for with bated breath. And if you're not coming, too bad.
We'll have to.
So sorry.
You're going to have to pay us to get the secrets. But maybe Hunter will share a little bit tonight, spill a little tea. So that would be fun. So without further ado, I'm going to bring Hunter on so that he can give you maybe a little bit of background and kind of tell us where we are. You know, we're 15 years in, you guys, into this redox story. So, you know, Hunter, come on, tell us what redox is for the people who are new, who maybe have not heard or not familiar with this. Tell us, explain to us what the redox is, and maybe give a little bit of snippet about, you know, where we came from and where we're going. And also, I love your backstory. Everybody loves hearing how you snuck in as a spy. And got a good job.
I'll have to decide if I'm going to tell that story at convention or not. I think a lot of people have heard it at this point, but it is a good one. So again, a little bit about my background. My background is chemical engineering. I grew up in Alaska. The original plan was to work in the oil industry. My wife's from Utah. So when we met, it became clear that I was going to be staying in Utah. Worked out great because now I'm here at Asea and I'm super happy that I'm here. Redox is a really cutting edge approach to health and wellness right now. In my presentation, not to give too much away, I'm going to talk about some of the perhaps shortcomings of the medical system and where Asea can fill the gaps. But really, what's happening with redox is it's the transfer of energy. There's reduction and there's oxidation. So reduction is gaining an electron or gaining energy, and oxidation is losing an electron or losing energy. And that's how energy is passed around the body. The body can't do anything without a signal, can't do anything without energy. And so how we work is through redox. Nothing gets done without redox. So it touches every function, every organ, every cell is kind of what we say a lot. And it's central to our health and wellness. Asea is at the cutting edge of this breakthrough technology. So 15 years ago, our founder, Vertus Norton, the late Vertus Norton, acquired the technology. He had just recently retired as a chief strategist for Kraft Foods. And he was sitting on the board of this biotech company. And he recognized the implications of this technology that they were working on, and acquired the technology, and decided to start a company on that technology. Now, when Vertus acquired that technology, it was not as advanced as it is today. At that time, they were still making it in 1 liter batches. So that would take a very long time to distribute the product today in 35 countries around the world. But the product has continued to improve. It's become more stable. That was the original breakthrough. In fact, people have been studying redox for a very long time, for over 100 years at this point. First Nobel Prize was awarded in the field of redox for the role of nitric oxide in the cardiovascular system almost 2 decades ago. So this isn't anything new. What's new is the ability to stabilize these high energy unstable molecules in a solution to allow supplementation. And there are just amazing benefits that come once you're able to supplement redox signaling molecules across a wide spectrum of important functions for health and wellness. Those functions for health and wellness that the medical system seems to fall short on. And so it's really this cutting edge technology that everybody can use, everybody needs. These molecules are bioidentical to what is created within the mitochondria of your cells. And so there's this term that floats around in health and wellness, bioavailability. There is nothing more bioavailable than something that is bioidentical. Right. And so if something is bioidentical, it is used immediately. The body immediately recognizes it itself and puts it straight to work. And so we see amazing and rapid results on this technology, and it's super fun to be a part of.
I love that, Hunter. That's fantastic. And, as a member of the medical profession, I agree. It's one of the reasons why I was so attracted to this. And so many doctors are now practicing into functional and integrated medicine, because we're trying to get to root cause, right? Not just give another medicine or another procedure, but to find out actually what's going wrong with the body and fix that. And in the case of these molecules, the reason that it helps to replenish these, whether it's a bioreplenishment agent, is because as we age or we're under stress, we become deficient or have an imbalance, correct?
Yeah, absolutely. One of the core concepts that I'll talk about during my presentation is the cause of health challenges. And I'll be a little bit more direct in my language during the unplugged session, but health challenges are the result of imbalance over time, right? A short-term or instantaneous imbalance, as long as your body can respond and get back to center, no health challenges result of that. But constant imbalance and growing imbalance, quite frankly, over time is what causes challenges in health. And so it's imperative to be able to build a body or to build a system that is capable of responding to the stressors that we find every single day.
Now, if you don't mind my asking another question, this product is made, our flagship product, ARS as we call it, is made from salt and water. So with the final product, after it goes through the procedure to break apart the bonds, electrolysis, as a matter of fact, you have these redox signaling molecules, but they are stable in the saline solution. Is that correct? So, or is it all redox molecules?
No, so the majority of the solution remains saline. A small percentage are converted to redox signaling molecules. The exact percentage is part of our trade secret and part of our patents. But those redox signaling molecules remain stable in that saline solution because of a specific concentration, specific pH, ORP. There are a lot of different parameters that we have to maintain in order to maintain a stable solution of these high energy molecules. And that solution remains stable for a very long time. Shelf life on the product right now is 21 months. So much better than the original, several days that it was stable for.
Hey, Hunter, you talked about energy molecules, mitochondria, producing energy. And then at the other end of this biological pathway, you have cellular responsiveness, what happens when. Can you connect the dots there and explain to our audience when the mitochondria or a supplemented amount of bioidentical signaling molecules is supplied the body, trace that down the pathway and describe why that matters to the cell and to the DNA in terms of how it's regulating things?
Yeah, certainly. You have a really cool term, Lee, that I like to use, and I'll probably use in my presentation of redox ohm. These interactions on a redox chemistry basis that are happening inside the body all the time. Really, the key concept here is your cells don't have a brain, they don't have a conscience, they don't get to make their own decisions for themselves. Nonetheless, there are important functions that they have to perform in order to maintain health and wellness for themselves, as well as the entire cellular system being your body. And so what has to happen is these signals have to be sent to these cells. These signals, just like a cell phone signal, carry energy, right? That energy is the signal. Well, in our first university biology class, or even in high school, we learned that the mitochondria is the powerhouse of the cell. And that's not just because it creates ATP through the Krebs cycle, which is used for cellular energy. It's because it also creates these high energy molecules that act as energy carriers or signal carriers to the cell to instruct them to perform specific functions to maintain health and wellness. To Maureen's point, as we age, as we're exposed to stressors, that process of creating redox signaling molecules within the mitochondria and transporting that energy to the cells where they need to go to begin those cellular processes breaks down. And so exogenous supplementation or supplementation of redox signaling molecules through our supplement adds the number of redox signaling molecules that are available for the cells to receive a signal so that they can do what they need to do.
Can you ever do too much signaling?
That's a question we get all the time. Not with our product. Our product is auto-modulating. And actually, we have some interesting research that I will point to at convention that shows the auto-modulation effect, specifically around the NRF2 pathway and glutathione. But the product is 100% non-toxic, 100% non-mutagenic. You would never reach a toxic level of this product. In fact, I like to joke that it's safer than water because in order to reach toxic levels of this product, you'd have to drink more than what you would reach for water toxicity. And you would reach that not as quickly on this product because it contains electrolytes. So it's completely safe, and it's not something that you would have to worry about taking too much.
Are you able to say any more right now about the responsive aspect of automodulation? What can you tell us? I have a little can opener here. I'm just
I know, and this is an area where Lee is particularly interested because of several conversations that we've had on the medical professional board.
Hey, real quick, hey Hunter, please explain what that is. I have no clue what Lee just said.
Yeah, so let me use it in the example. Let me use it in the example of glutathione. So there's a difference between endogenous formation of glutathione, meaning your body producing its own glutathione, and exogenous supplementation of glutathione, meaning glutathione supplements or injections. Okay, there are two very different things. In the case of some health challenges that involve bad cells, there are papers suggesting that you would want to avoid glutathione supplementation because of the accelerated process of bad cells. What we're finding is that when you supplement with exogenous glutathione, your body's going to use it regardless. You've put it into the system, it's going to get used. With redox signaling, your body is capable of recognizing the amount needed of glutathione, let's say, and produces the amount needed, but no more. And so this is happening because of a systems perspective on redox signaling molecules. What we find in the research and what I'll cover next week at convention is this concept of auto-modulation, meaning the body produces it when it needs it because it's getting a bioidentical signal to what it would produce itself. And if it's not needed, it no longer produces anymore.
I just want to punctuate what he just said because this is such a critical element of the whole story. And that is the body's natural system that it utilizes to upregulate a cellular defense strategy. it knows when it's in trouble, it knows how to respond to it, and it knows how to turn itself off when it's not needed anymore. And that's not what happens when we top load vitamins or minerals or herbs or anything in excess, because those have to be processed through the liver. The body has to metabolize those, and that all has a half-life, and the effect doesn't really go away until that half-life is spent a couple times until it's down below. So, maybe not everybody will understand what we just talked about, but that is a critical, important benefit of Asea redox signaling supplementation because of its bioidentical nature. It's recognized by the body's processes as working similar to what the body already does, and it's not something that's top loading or adding on to. And there's just something, I was asked by a physician earlier this week about that process. So if I have X amount of oxidation and I add X amount of redox signaling molecules, will I have 2X amount of oxidative stress? And the answer is, well, if you'd acquired that oxidative stress through other measures, maybe so. But it's not our belief that that is what's happening here, and we're having the evidence to support that. And I look forward to more coming out from you, Hunter. Thanks.
Yeah, it's
Hey, we lost.
There's more.
We lost. Oh, you're back. You're back. Your mic. No, your mic goes in and out a little bit. It was gone. Now it's back. Go ahead. I'm
sorry.
You're good.
There's more to the story than what we'll cover just in conventionally. You'll be able to see a little bit of a sneak peek on the next MPB meeting. I'm going to hang that out for everybody just to know that we're continuing to work on it. But there will be some cool stuff at convention. You certainly want to be there.
There was some cool stuff, but I don't know if you're going to share any of that that we were talking about at the last medical professional media.
We won't tell anybody.
Can opener, just trying to get it open. One of the studies that we talked about in the last MPB meeting, we will be talking about during the Unplugged session.
Fabulous. You guys, there is so much on the horizon. It's so cool. Sorry, that's one of my cats. I don't know if you hear that wailing up there.
Oh,
Y'all don't hear it?
Don't hear it.
no.
Oh, okay, good. I should have kept my mouth shut. Anyway, somebody was talking about, can you maybe speak to the electrolytes that are in our solution that it's made from, and how that differs from electrolytes that a athlete would be consuming to replenish?
Yeah, certainly. So it's not electrolytes in the form of Gatorade or vitamin water or any of these products. Sodium in electrolyte, we mean very literally the chemical definition of an electrolyte rather than a biological or nutritional definition. An electrolyte by chemistry definition is capable of conducting electricity through a solution. And so sodium and chloride are the two electrolytes that we refer to when we say electrolytes. And those are the two ions in solution that will conduct the electric current during the patented electrochemical process. So there's not an overwhelming number of magnesium or potassium or anything like that being added to the product. It is sodium chloride and water broken down by our process and rebuilt into redox signaling molecules.
Well, more specifically, it's deionized water. So you're removing all of the other impurities, which is one of the other important features of what we have.
Yeah, I was going through, we catalog trade secrets so that, for continuity's sake. And I was going through them and I realized there's an entire section of trade secrets, pages long, on water purification. And that's a huge component of making sure that the product is as stable as it is. I never knew I'd be such a water nerd, but here I am.
Can we speak to the purity of the water, or is that a trade secret?
Oh, we can certainly talk about it. I don't go into the exact processes that are used and in the order and things like that, but we can talk to the purity of it, certainly. We have a two-step process. The first is a reverse osmosis system. It's what many of us in the United States have to soften our water before it goes into the house. And then the second portion of that is a deionization system. Our deionization system is very sophisticated. It's very similar to what they use in microchip manufacturing plants. As you can imagine, microchips are very sensitive to mineral deposition as they're depositing silicon layers together to make the microchip. So it has to be extremely pure. So we use a system that is in use at microchip manufacturing plants. And the reason for that is there are really three types of compounds, three categories of compounds that'll denature or destroy redox signaling molecules. And that's metals, minerals, and organics. Organics, think bacteria, fungus, plastic foods, anything like that. So all of that has to be taken out of the water before we can put it through the process to make redox signaling. Water nerd, here we go. I'm geeking out on water, guys. But what's interesting about our system is it gets the water so pure that it's below our detection limit in our lab. We can't test the water to the purity level that we achieve. And so people often ask, like, okay, well, if it's below your detection limit, how do you know it's as pure as you say it is? So we worked with the system, the company that developed the system, to come up with a test method using electricity. For those of you who don't know, water does not conduct electricity. It's the minerals in the water that conduct electricity. So if you pull all of the minerals out of the water, it no longer conducts electricity because the resistance is super high. So you can measure that resistance in that electrical circuit through the water and tie that to the purity level of our water. And if you convert the resistance to part per million, you actually end up at a part per trillion level for trace contaminants. So it's extremely, extremely pure water. That was more than anybody ever wants to know about water purification, but there you go.
Yeah.
I think it's fascinating. I love it.
Yeah.
So we're taking really pure water and very pristine salt, right? Kosher salt from the Morton salt mines.
Yeah, it's kosher salt. It's also what we call USP grade, US pharmacopoeia grade. It's the same stuff used in pharmaceutical manufacturing and saline bags in hospitals. So extremely pure salt, extremely pure water, all done for stability, purity, and efficacy sake.
Wow. That's awesome.
Can you go ahead and touch real quick on the story behind Redox Gold?
Yeah, absolutely. Redox Gold's a really, really exciting breakthrough for the science team specifically because it changes how we thought about redox. So redox, at least on the science side, was kind of viewed as this broad spectrum, foundational, base type product that everybody need to foundationally support health and wellness. What we found with our research with the University of Bath, the University of Western Sydney, was that you could add noble metals to the solution with a catalytic effect to change the response from the body. So it focuses redox signaling molecules into specific channels or pathways. Redox Gold happens to be the recovery and relief pathway that really stimulates NRF2, which is the key anti-inflammatory pathway that the body has.
So what was that part of the story that when you received the phone call or you received the study that you had to go take a walk? What was that? Because something hit you that goes, this is gigantic.
Bigger.
This is big.
Yeah. Well, what it was so when we got the call, when we got the results, I went and walked outside and just kind of sat and thought about things for a little while. And the reason that is so substantial is you're taking basically a form of energy that the body recognizes as self, and you're using a catalyst to no longer just say, here's the energy, use it how you will. You're saying, hey, this is where you need it, use the energy here. And so it opens up an entirely new product category for us of targeted redox products, meaning we can signal specific pathways to specific results and specific benefits using different catalyst compounds. And so it really shifted the paradigm in product development on what we can do with this technology beyond the core technology.
And there's no duplication between Renew 28 and Redox Gold.
They're very different. They're very different products. That was one of the challenges when we were developing this product. We're like, hey, how do we distinguish these two? Because they're both a clear redox gel in a tube. Despite the appearance, they are very different in how they're formulated. They're very different in how they're made, how they're even from a functional standpoint, they act very differently. When we put Redox Gold through cosmetic testing, there was no benefit to the skin.
Did you think there was going to be a benefit, or you just really had no idea?
We didn't know. We saw the elevated anti-inflammatory results, and we thought, hey, that's super cool. What else is it doing? But at that time, we didn't realize that it was a catalytic effect, meaning it's taking all of the energy and focusing it into a specific pathway. We were thinking, oh, maybe that one pathway is boosted, but there's still all these other parallel benefits. And if that was the case, it probably would have just been a Renew 2.0, right? It would have been, hey, it does everything Renew 28 does, but it does this one thing better. But it didn't. It basically takes all of that redox potential and pours it into a single bucket, rather than spreading it out across many different pathways.
I was one of the beta testers, and I actually thought it did help my skin, but it's because, it's very creamy. So when you put it on your face, it just feels so good. So I was like, wow, I love, plus it has those little gold flakes. So
Oh yeah.
shimmer, So
Now, is it the pH? Is it the pH that's different and makes it when they formulated it? I hadn't heard that.
pH is one of the components that's changed, or one of the attributes that's changed. The distribution of what types of redox signaling molecules are in there is different. The concentration is different. The viscosity is different. Some of the buffers that we use in order to stabilize the product are different. So it's really a formulation from the ground up to maximize the effect of that, relief and recovery type product.
Hunter, how many redox molecules are there? I've always wanted to know the answer to that, and I've got another question I want to ask you as well right after that.
Yeah, so it depends, and this is probably not going to be your favorite answer that I give, but it depends on your definition of a redox molecule. So a redox molecule
I'm not
is anything.
sciencey. I'm not medical. I ain't Lee or Maureen or Ann.
Sure.
What is it? Yeah, tell me.
When we're talking about our product, dozens.
Okay.
Right. As far as what's directly in the bottle, but also which ones are active in the body and which ones are widely considered as main redox signaling molecules in the body. You're looking at dozens of species.
Okay. My other question is, well, two. Because of this experimentation and what happened with gold, and I know you can't really answer this, but are there other things in the works? Are there other things that you mentioned targeting things? I mean, is there more coming?
There is always something in the works. Asea never rests. Asea invests hundreds of thousands of dollars every single year into research and development and product development. So we kind of have several channels going on simultaneously right now in next generation targeted redox products, in improvements on the core technology, and improvements on products that stack and pair well with redox based technology. So there's development going on in all fronts. They keep us busy on the science side, that's for sure.
Hunter, if you don't mind me, one last one, maybe. Of course, I never tell the truth. This has been on, we're having our 15-year anniversary, and it's actually a 16-year-old company. Did you think, looking back at the history, that this would have moved quicker? Do you think it would have moved faster? And because with what we have is so massive that it still is shocking. And a lot of people, Hunter, and I wanted to ask you this as well. Do you have any family members that are medical that still look at you squirrely and go, oh my God, this kid's lost it? Do you have a hard time getting your friends and people you know to believe that what this stuff is real?
Yeah, so a couple parts to that question.
Yeah.
If knowing what I know now, if Virtus would have came to me and said, "Hey, do you think now's the time to launch this technology?" I'd say you're too soon. The world's not ready for it. And what I mean by that is, hey, people need it and you should launch the technology, but it's an uphill battle because it's not being researched at the university level yet. And mainstream science, mainstream health and wellness trails university research by 15 years or so. If you look at university research now, there's quite a few studies going on in redox. So what's going to happen in the next 5 to 10 years is redox is going to become mainstream. And Asea is positioned really well to take advantage of that. So I think that's one of the reasons why Asea has not simply just exploded into every home around the globe. Is the science has to catch up a little bit. Virtus truly was a visionary and recognized what he had with this technology. And so waiting on the world to catch up just a little bit. As for family members and friends, I myself found this hard to believe when I first came to Asea. I too thought, hey, salt water from Salt Lake City, Utah, that's a fun story. You start looking at the data, you start researching the science, you start looking into everything that's been published on redox in the body and these molecules. It's real. We have the data to prove it. I've seen it with my own eyes. There's a lot that we can't even talk about that is just it astounds me. So I myself had to go through a little bit of a research and trial period before I decided that I was going to be here long term. But yeah, I still get lots of friends kind of side eyeing me when I start talking about these amazing products and these amazing molecules that'll help them recover faster, and so they go to the gym more often until they try it, and then they ask me for some.
That's it.
I think part of the trending here is also we see things happening. You talked about it would have been too early or late or whatever, but what's going on right now is there seems to be, I'm not quite ready to call it an implosion, but there's certainly some reversals. You know, they're putting the brakes on the traditional medical model as the solution to everything. Understanding the import of nutrition and processed foods or ultra processed foods and the effect that has on the body. And so if there was ever a company or a product or a science that spoke to the principles of natural healing, it's this, because this is, as I say, this is awakening the inner doctor. If you want to heal from the inside out, these pathways are how you do it. And the future of health research in the next 2 decades certainly is about anti-aging. It's becoming, 5-10 years ago, that was almost kind of science fiction-ish. And nowadays, to biohack or to manipulate the mitochondria to provide things to the body that mimic, the natural processes in a natural way, that's becoming the thing to do. And so, the saying is a rising tide raises all boats. You just want the best boat in the harbor when the tide rises. And so, anyway, that's something that we can piggyback on because it's language that everybody understands or is starting to understand. And they're losing the drug mindset, like we still think that way because, I probably get a dozen questions every week, and will it help with this? Will it help with that? And it's like, take that condition and just put it in the file cabinet somewhere and learn about cellular health. If there's a cell involved and the cell works better, then whatever it is you want to name is going to be improved. Although we don't make claims, which we should stop right now and make that disclaimer since we haven't done it yet. Except for Hunter Dean, the rest of us on here are associates of the company AseaGlobal. We represent it, and we're distributors in that regard. And this is governed and regulated by the FDA supplement rules, and therefore we don't make any claims to treat, cure, disease, or diagnose disease.
Hunter, what is your networking with this kind of a breakthrough coming out this channel? What are your thoughts on that? Using network marketing as the channel to bring this to the market, to bring this to the world, whereas this is so far advanced from what any medical people will ever see, but yet we're coming out, and that's confusing to a lot of people. But it's a blessing to us that choose to work it.
Yeah. I don't think this product, given the timing and when he acquired the technology, would have been successful in any other way. And what I mean by successful is probably globally distributed. There were a few options that Virtus had when he acquired this technology. It was one, dump a bunch more money into it and go to FDA testing and trials and hope that the FDA was smart enough to recognize what he had on his hands to approve it as a pharmaceutical. The problem with that was first cost, time, and then also distribution. The FDA would control it and basically allow its use for one specific category of health challenge or disease. Virtus, from the very beginning of acquiring the technology, had friends who were on the product and were benefiting from it. So Virtus's goal was not to make lots of money. He had done that with craft, and his career was very successful. He saw what this could do for humanity, saw what this could do for people. And so his goal was distribution. Make a profit off of business venture, of course, but he wanted to get it to people to help people. And so pharmaceutical was not the way to go. The other risk through retail is the population or the consumers wouldn't get it. Imagine walking into GNC and seeing a supplement on the shelf for, $150 that said salt and water, right? There's no way to be able to tell the story in a storefront. And so this needed professional entrepreneurs to be able to try the product and tell the story, to be able to share it and be able to achieve global distribution. And so while I think he probably had some scrutiny from those close to him at first when he chose the channel, I think it was a real stroke of genius to be able to figure out, and really this is where Virtus shined, right? He was a strategist. So he was able to see the strengths of this channel and really where it would lead him in achieving his goal of global distribution of this life-changing technology.
Hey, Maureen, can I ask you a question to have you recant a story of when you and your amazing husband were meeting with Virtus the first time? And he shared a story with you about a remarkable, what it did for someone. Remember that? You know which story I'm talking about?
Yeah, absolutely. And, it was an interesting story, and interesting, especially to me. It was a woman who was incontinent, and hope I'm not giving any diagnosis there, but, I started my medical career in urology. So that was of particular interest, but I thought, what a strange thing. I'd asked him, what was one of the most impactful stories that you had heard? And he was telling me about this woman, and she was fine after, it had affected her life where she couldn't go out. She was embarrassed, having to take measures to control it and all. Got on the product, and those situations seemed to clear up. And I was like, that's an interesting story. Why that? Why is that the one that impacted you? And he said, it's because of human dignity. And I thought, wow, he wasn't trying to grow a third arm or, whatever. I just thought that just spoke to who this person was that was leading the company, that another person's dignity was that important to him. So it speaks volumes. So really,
I've always remembered that story. That was crazy.
Yeah, that's when I think Joaquin and I said, you know what, we're aligning with this guy.
Yeah.
Yeah.
Hunter, Alan Noble calls it I'm going to maybe title a bit, but the trifecta. Can you maybe speak to that, which is the company, you, home office, the field leadership, and the technology? As an ex-financial advisor, I don't think we will ever see anything that comes close to the perfect opportunity, the perfect company. I mean, it just, I know people may not believe that. It may sound kind of corny, but it's true. You know, it seems impossible what we have, but yet 16 years, 35 countries, guys like you and Jerem and Tyler and the whole, I mean, and then the Alan Nobles and Trish and Denny's and Maureen's and Lee's and all it just is the perfect opportunity for people. How would you share this with someone to get them to want to come in and take a look at the opportunity?
Yeah, it's really interesting. So, as part of my role, one of the things that I'm looking at doing, and I'm currently in an MBA program right now, getting my MBA. One of the things they talk about on business strategy is looking at the core competencies of an organization, right? An organization should build its strategy around competencies that it already possesses rather than trying to go and acquire competencies for acquisition's sake. And you speak about the trifecta, right? I view those as core competencies. So you have the technology, second to none. We're the only ones who have it, right? So talk about competitive advantage. You have a distribution system with a huge network of expert marketers that are able to tell the story of this product. They're able to distribute the product. They're able to reach people who traditional marketing systems are unable to do. And then third, you have the company, the executives, the founders, who are aligned with the mission of being a force for good in the world, right? So when you look at those three core competencies, you really have a combination that comes around very, very rarely, once in a lifetime. I've heard Alan say once in a generation, more accurately perhaps. And I think it's totally accurate. You don't have many organizations, none that I've seen in my career thus far, that have those three core competencies in spades to be able to create this kind of an opportunity. Whether it be you're looking to change people's lives for the better, whether it be you're looking for financial improvement of your situation, whether that be an ethos perspective of, I believe that there is a global family and we all want to advance together and we want to work together to improve people's lives around the world. No matter what your focus is, your home can be here.
That's excellent.
That's awesome.
Yeah.
You know, if we were going to dumb this down, Hunter, you know, I like to use the analogy of we're recharging our bodies, recharging our cells, kind of like a battery for our bodies or electricity, you know, and it goes generally throughout the body. It doesn't matter, like the electricity in your house, it doesn't matter if you plug in a refrigerator or a hair dryer, it's going to turn on. And I think, you know, a simple idea like that is recharging our cells. Would you agree, or is that too simplified?
Yeah, I would agree 100%. In fact, it's funny that you bring up that example. Andrea sent me an article today that speaks about just that. In fact, the title of the article is "Life is a Multi-Scale Electrical Circuit." So I'll send that to you later for some light reading. But I think it's absolutely accurate. You can think of these redox signaling molecules as recharging your body or recharging your redox ohm battery, right? These are energy carriers, and your body, in order to perform the functions that it needs to maintain its health and wellness, needs energy. And as we age and as we're exposed to stressors, we have less and less in our battery, and so we need to be able to recharge. Asea helps us do that.
Awesome. Yeah, I was curious. You know, we're getting ready for convention, super excited about the new cell performance. And I know you can't reveal too much, but maybe we can talk about how those ingredients, because we, of course, have Radiance and we've got the new stuff coming, but how taking those, share the benefits of adding that to our redox potential, though there's not redox signaling in them. but how they are made, the impact it can make for people to consider starting to consume them. Like we do Radiance every day. We saw all the benefits of the other three. We're excited to get our first batch. But not knowing, how y'all are changing it, if we could just stick to the reason people need to consider cell performance in their daily routine because of how they're sourced, how they're made. She's got it already, but I'm not sure if that's the sample, the new stuff.
It is. I'm sure it is.
Awesome.
Well, I have samples, but no, I'm going through my old stuff. I stocked up.
That's what I figured. Yeah, we did too.
Well, I just want to.
Yeah.
Yeah, I just want to throw in real quick as Hunter, you will be with Alan Noble on September the 11th,
Oh, wow.
which will be the first Thursday where we're back. We will not be here next Thursday for obvious reasons. Yeah. But Alan, you will be with Alan Noble that on September the 9/11, discussing this exact topic in full detail.
Yeah.
Yes. Yep. So we'll go in.
Yeah.
We'll go into it in the nitty gritty on September 11th, and I'll go into it obviously in detail at convention, but I'll give you guys a little bit of a high level overview as to why the performance products. In my presentation next week, I already mentioned I want to talk a little bit about the shortcomings of the medical system and the healthcare system more broadly. There is a natural incentive from a financial perspective for physicians to continue to specialize, right? And Maureen, if I'm stepping outside of my bounds here, please jump in. But there's always a financial incentive to specialize into the next thing and become more and more specific as a physician. This has had kind of a side effect on our healthcare system where it's been compartmentalized. From a perspective of I have a very specific issue that I need solved, it's great at that. It's really, really good because you've got a physician that does only that. The problem is our health is a system. It is not a compartmentalized list of different aspects of health. It is a biological system. And so what happens is there's been kind of this shift, and Lee talked about it, diet, health, exercise, lifestyle, this holistic approach to health and wellness. This is where Redox really shines. This is where Asea Redox Supplement, Renew 28, Redox Gold really shine because it's the foundational health and wellness. It is central to everything that we are as human beings. Our life depends upon Redox. But there's another side of the coin. Obviously, there is benefit to specialization and compartmentalization, right? There are those of us who really want to perform better at the gym, or we're competitive athletes, or we're maybe we have a goal and hey, I want to hike that mountain, or I want to be able to play with my kids, or my grandkids. There are specific benefits that we're looking for that when you combine holistic health practices, both through healthy lifestyle choices, but also Redox, with something that is specifically formulated to a targeted benefit, you get a real synergy that happens. And what happens is the Redox signaling technology primes your body to be more efficient with everything that you put into it. And so when you start taking products like Performance, when priming your body through the Redox pathways, you get a huge synergistic boost. So these products are formulated to be powerful on their own. But with what we know about Redox signaling pathways, as well as metabolic pathways through these energy, mind, and mood products, there are real synergies that happen. And I think that's the direction that Asea is going, is as a cellular health company, there's a real opportunity to tell a story behind stacking multiple products. And that's kind of the basis for this reformulation on the cell performance.
That's great.
Hunter, isn't that also true for the Via line and also for the skincare, that they all are working with Redox? Synergistically working with Redox as well? So
yeah.
Okay.
Yeah, 100%. Go ahead.
That's great.
Well, I was going to ask you, I ask this question every time of guys like you, and this is such a gigantic thing, and Maureen and Lee can testify to this, obviously, but why doesn't anybody else have it yet? Why is it so I mean, every time there's a massive breakthrough, Hunter, and you know this, the Orientals or whoever, they've got a mimic out. They got the twin, the exact replica within a matter of days. No one's had this for 16 years, and maybe that's part of the being accepted into the marketplace. And I think our penetration into the market is maybe 0.01%. No one knows anything about it, but it's because no one else has it yet. We're the only provider still. And in your opinion, do you think we will remain the only one?
In the short term, yes. In the long term, people are going to try and copycat more and more. People have already tried to do it. We've seen companies that have tried. We always order their product and test it, and it's never been what they claim it to be. But there's a couple of factors, right? One, we talked about universities researching it now where they weren't 15 years ago. The public health and wellness follows university research by about a decade. So the public eye is just not on Redox yet. And so it's not attracting a ton of attention from a business perspective, for a lot of people. People who understand health, wellness, biology, chemistry, they're going to be inclined to jump on this first. The second part of that and why it hasn't been copycatted is it's really hard to do. There are 7 patents, over 1,000 trade secrets at this point around what we do to make our product what it is. 15 years in improvement and development. Also, we're very careful with our intellectual property, even down to the fact that we have a 3D printer so we can print parts in-house and not send designs to external servers. It's only manufactured in Pleasant Grove, Utah, so that we can control all of the data, we can control all of the intellectual property. It's not being housed on email servers overseas. It's not being manufactured by technicians overseas. It's all held here. So one of its public awareness, there's not a huge awareness yet. I think in the next 5 years, it's going to shift. It's really hard to do, is the second answer. And third is perhaps for Asea specifically, we've been lucky. Sometimes there's an element of luck and things fall your way for a few years in a row and people don't catch on, but it's coming, and that's why Asea is advancing the ball so quickly and investing so heavily in research so that when others do come, we are the top dog in the redox space.
Okay. I may call that a divine gift instead of a happenstance.
Yeah.
Sure.
You know, Lee, if you don't mind answering this, there's a lot of other technologies that are going to pop out. And I heard someone say that Asea is the headwater. We are at the beginning of all the body taking care of itself. There will be other things that come along that could be an advent too, could be good stuff, but it's not where we are. Can you address that real quick?
Well, I think the way to approach that is to think about how the body works. You know, this is the advantage of having some knowledge about how cell biology functions. I'm a believer that if or when we get better, if a cell becomes stronger and more healthy, it's because these pathways have been activated. And there's probably 30 or 100 or 500 different ways to activate the pathways, which is why we have a plethora of products and gizmos and gadgets and red lights, and even marine today is fasting. That is a very natural mechanism that activates these pathways. If we were to measure her blood work, we'd find out that we'd have some positive results because she's fasting and she's doing some keto work right now. She's cycling. And so we have some athletes in our midst who go out and run and exercise and triathlon or do calisthenics every day. That is also a redox. That's also a redox phenomena. So anybody that comes along with whatever they have and says, yeah, this works equally well or also well or whatever, the reason why they work is they're playing on these pathways. That's what nutrition does. That's what herbs do. That's where vitamins play. That's where cell performance plays. They're all playing on the redox landscape. We talked about that earlier as the redoxome, like a genome. This This is the way we're made, the way the cells work. So the answer to the question is, in my opinion, is which one of these is the most foundational? Which one is the most upstream? Which is the most closest to the absolute source, which would be the mitochondria? And in my esteemed opinion, we have the corner in that marketplace because we are the most basic, the most upstream, most grounded, foundational, whatever word you want. We're the furthest up, again, which doesn't take away from ketoing or exercising or fasting or red lights or other things that you can place on or in the body. All of those work not by magic, but because they have some part to play in some of these pathway genes that are associated with our survival and our longevity genes. We, I think, have a unique stance in the market because we have you've heard this mentioned a couple ways tonight. We have a broad spectrum application that affects all redox sensitive genes. And we have focused targeted capability that plays with specific pathways, which I would love to spend the next 90 minutes and help Hunter describe, but I can't and I won't. I would be yanked. Anyway, but that's my answer, is that none of this is magic. This is the way the cell was designed. There's no hocus pocus with any of this stuff. It's the question of what's more complete, what's more basic, what's more upstream, what's more generic, what's more associated with the inner doctor.
Maureen, can you, real quick, a couple of minutes? You're a traditional MD. Did you ever think you would see anything like this ever? Honestly,
I had been searching for this because, just very quickly, one day, my husband's a physician too. We've been physicians for decades. And, one day I made the comment to him walking into the hospital, are you surprised that every day we come here and the parking lot's full, the waiting rooms are full, the surgical schedule's full? And he said, what are you talking about? And I said, well, I just thought, we're practicing, all of our friends are practicing. I just thought at some point in time, we would get ahead of the curve and there'd be nobody to treat. We could just have coffee and chat all day. And he thought that was the funniest thing he had ever heard. And I was serious. I was like, I'm not sure we're getting people, because when when you go to your doctor, it's because you've gotten sick. You're going, if you think of your health as being a staircase, it's not until you start going down those stairs that you seek medical attention.
Yeah.
And your doctor's just trying to get you back to where you were. You've got to take yourself to the top. And that's what we're doing here. In a word or in a sentence, our product makes everything else work better. So we're not saying don't do all the other things that you need to do. The more good you can do for your body, including fasting, the bigger bang for your buck you're going to get from the Asea products. So, it's foundational. It comes before. People were mentioning other products. Ours comes first. Use those products. Fabulous. If you want them to work the best they possibly can, make sure your redoxome is in balance.
Can you go over the ripple effect real quick, Maureen, if you don't mind?
Sure. I think of what we're doing as, because as a physician, I could only see the people who came into the clinic that day or that were on the OR schedule. I only impacted those people. And, when you're coming to your doctor, you don't normally go home and share the therapy with your friends and family, right? But here, because what we're doing is imparting information, we're teaching people, we're empowering people. It's like dropping a stone in the middle of a lake, and that ripple effect goes out further and further. You don't have to be a doctor or a healthcare practitioner to be able to share this information with other people. You just have to care about them enough to let them know that this is an option for them. And it was amazing to me as a doctor to be able to have that kind of impact, not only on the people that I was sharing it with, but that they would turn around and share it with others, so that the 100 or 200 people that I personally shared it with has turned into thousands all over the world. And that is an unbelievable blessing. It's just incredible. So,
Hunter, how does that make you feel, knowing that you're at home off? I mean, you're there. I mean, you're the key, one of the key people there. How does that make you feel to realize the lives that you, because of what you've been able to help this company do, How does that make you feel knowing what effects, the ripple effects that are in 35 countries now, all over the world because of your efforts and the team, not just you, but the team?
Sure. Yeah. First, super grateful. One of my favorite things about my job is being able to hop on calls like these, talk with customers of the product that have had life-changing experiences. If I were in a different role or at a different company, it would be really easy to just I make a product and people buy my product. But this is different. This is people's health. This is people's lives. This is people's families that are changed for the better. And so it's super gratifying to be able to be a part of that. I would also say it's pretty humbling when you see the work that we're doing here and how many people rely on this technology. It makes us treat work differently. We take it very seriously here because we know people depend on this. People need this. And we are the standard bearers for this technology. And so it is on us to represent it accordingly. And so we take that very seriously here.
Can you real quick, we're a little bit over. This is for people that want to be proactive as well. Not, I don't have any issues. I just don't want to have any issues. I'm 68 years young and I don't want to be surprised by something bursting. So speak to that real quick. It's keep your health. Maureen, you've talked about that. Lee, speak to that real quick, Hunter. Sorry, Maureen.
I'm 32 years old. I take it every day. In order to maintain health and wellness, you have to get to the top of the staircase, the way Maureen said, and you have to stay there. You're never staying at a stair step. You're either going up it or you're going down it. And disease, the onset of disease, is imbalance over time. If you are not in balance, it is only a matter of time. This product helps you get in balance. If you want to have health span, not just lifespan, you need to start early. You need to do it now. It's not just when you have issues should you be going and treating it. You should proactively be going to maintain health and wellness for your entire life. That is what this product is about. It's about health and wellness at its core, and it helps at a foundational level.
That's fabulous. And a quick compliment. So those that want to learn more about, what all goes on behind the scenes, you want to see Hunter and the teams, go do a tour, or you can even look up there is a video about the tour of the facility. And Hunter, I love those little videos y'all two do with the global ASEA page through Facebook or Instagram. I follow all those. So
oh, good.
Good job.
Good. I'm glad. Yeah. We try and do them every week, Thursday on Instagram now. So
that's awesome.
Well, guys, thank you. Hunter, as always, thank you. Can't wait to see you
Unplugged.
Next week.
Hunter Unplugged. And I'm sorry, guys, as far as we're aware, there is no Zooming. There may be some people doing some private Zooming, but not when Hunter talks. That's going to be a massive no. Get kicked out of
Just
convention
in Mexico.
if anybody attempts to record it. But there will not be a show next Thursday. And again, September 11th, Alan Noble will be back with Hunter Dean. So that's the one that you don't want to miss. So with that, guys, thank you. God bless. This recording will be available within a couple of hours at redoxmatters.com. With that, God bless. Thank you, Hunter. Can't wait to see you.
Thanks, Hunter. Great call.
Thank y'all.
Happy Labor Day. We'll see you next week.